Hey guys, welcome back to Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular. Today we're going to talk about vascular disease in athletes. So these are young, otherwise healthy people, not really the population that we think about for typical vascular diseases. However, these situations do come up. There's just a few conditions. I don't intend for this to be a comprehensive lecture, but a few conditions I just want to mention. The first one is called compartment syndrome. Compartment syndrome is something that comes up in the kind of more urgent setting after trauma, after some vascular operations, if we're restoring blood flow to a leg, for instance. If you have a fascial compartment that is too small for the muscle within, whether the muscle has become inflamed and is swelling, maybe you just have a hypertrophy of that muscle that has happened faster than this fascia can expand to allow. Essentially what can happen though is you can get pain and actually destruction of the muscle tissue, damage to nerves and vessels that are also contained within that fascial compartment. Then the treatment involves opening up that fascia to allow the muscle room to expand. As it pertains to athletes, we tend to see thoracic outlet syndrome come up in people that participate in overhead throwing sports or sports where there's a lot of overhead activity due to muscular hypertrophy around the base of the neck, the shoulder, under the collarbone. What happens is we get compression of the structures that pass through the thoracic outlet. All of these structures are tightly packed in between these collarbone and the first rib, and so we have to open up that space. And so typically the treatment is removing the first rib. Popliteal Entrapment Syndrome, falls into a slightly different category. It has to do with the structure and the relationship of your calf muscles, your gastrocnemius muscles, and your popliteal arteries. It might only be felt when they're out running at a 6-7 minute mile pace. For that person, it's still abnormal. External iliac endofibrosis. This one is rare. This tends to be something we specifically see in very high level cyclists. The external iliac artery, which is essentially the last part of the iliac artery as we travel from the belly and the pelvis, that vessel passes right on top of some muscles that are important for our posture and standing and moving in our hip supporting muscles. But in particular, these muscles are involved with cycling, especially when you're in a really aggressive cycling position. And if you think about the repetitive motion, every time you pedal, these muscles are going to be flexing and contracting and interacting with those vessels. The vessel can actually get so inflamed that it will start to narrow on the inside. Thanks for tuning into Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular.